How can we promote better health and better care at lower cost for the elderly with chronic health conditions? Through TELBIL, a home telemonitoring initiative with primary care at its center. What is TELBIL? TELBIL is a telemonitoring initiative for home care patients with heart failure and chronic lung disease that enables them to be monitored and cared for by nurses and GPs in their own homes. A randomized controlled trial with 58 of these patients led to very positive outcomes. The fact that the patients were elderly, very sick, with limited computer knowledge, and that primary care was put at the center of this intervention make it particularly useful and interesting to replicate. How does TELBIL work? Patients have a smartphone personal digital assistant into which they input daily measurements of blood pressure, heart rate, oxygen saturation, temperature, and weight, and answer questions about their medical condition that day. This is sent via the web to primary healthcare professionals who review these data. If data is outside of parameters established for each patient by the health professionals, alerts are triggered in red, upon which patients are immediately contacted. Patients are called by nurses for follow-up every 2 weeks. When there is a health concern and the health center is closed, alerts are sent to the patients, encouraging them to contact an emergency service. Why is TELBIL useful? TELBIL is useful because it identifies problems early. It enables a swift response to patients. It reduces patient visits to hospitals. It optimizes the use of healthcare resources. It reassures patients by providing regular, continuous care. It increases quality of life, and it empowers patients to manage their disease themselves. Where has TELBIL been implemented? This project was implemented in the Basque region of Spain during 2010 to 2014 to address chronic health conditions and improve their management. It was first tested for a year as a controlled trial with very successful results. Based on this success, TELBIL A and TELBIL T were each implemented for 2 years. Some results. The main intended result, the number of hospital admissions, experienced a significant decrease thanks to TELBIL. 43% of telemonitored patients had no hospital admissions after 1 year, compared to 14% of patients who received standard care. Patients, their caregivers, and professionals were also happy with the telemonitoring service. Surveys show that 81% of patients and caregivers and 86% of GPs and nurses were satisfied with the intervention. A cost-effectiveness study indicated that the telemonitoring intervention was cheaper and more effective than standard care for the same type of patients. Conclusions. TELBIL is an innovative telemonitoring service. Although there were limitations to the intervention, such as a small sample size, delays and failures related to the technology itself, and the learning curve required of the technology, TELBIL has shown to be a compelling and valid alternative for successfully managing elderly patients with heart failure and chronic lung conditions in their homes.